I'm Shanny Dyer, the CEO of ARCS Australia, and we're here at the ARCS 2018 conference. We've just had the plenary on day 2, and I'm here with two of our speakers. We have David Hay and Chris Fonsi. David is from Orion Health and is a fire evangelist, and Chris is from Google. So, David, we're talking about fire. What is fire and why do we need it?
So FHIR is basically a standard. It's a way to actually share information between systems in a way that both systems can understand what that information is that's being shared. So that's the technical answer. But actually, what's even more important about FHIR is a community of people. And I think if you talk to anybody who's spent a lot of time with FHIR, what they will tell you is that it's a very easy way to reach out, to find help for assistance with any kind of issues that you may have. And it's also a way that you can bring your own desires and needs back into the standard and help it out. So I think that's how I would describe FHIR.
So if we're talking about fire, I mean, I'm imagining that it's about how we can take data and pull it together so that we can turn it into information.
That would be a fair comment. Collecting data, particularly high quality data, is not straightforward. The so-called semantic interoperability is how we used to call it, so that when I say apples, you understand that I mean apples and not oranges, for example, to use a silly example.
Oh, I was thinking more Apple rather than Google. But going over to Google, Chris, so once we've got data, what are the sorts of things that we can do with it?
So for most problems, there are basically two classes of tooling and techniques that you can use. One is very large-scale analytics, where you can bring this data, in many cases in FHIR format, into a large analytics engine and manipulate that data to derive some insights about what's going on with patients, what's going on in organizations, and so on. The other one, which is much more advanced, is machine learning, where you can actually reason about data. You can develop a model that allows you to ingest data and produce predictions and so on. And you can use data that you ingest from FHIR and other sources to train those models along with information that you get from researchers and specialists in particular areas. That specialty information combined with the raw data allows you to produce insights which can then be fed back into the clinical space and patient care.
So on that, one of the slides that you showed to us, Chris, was about diabetic retinopathy and the ability to scan many images of retinas to look for diabetic retinopathy. I can see that can be applied to other areas of diseases. What sort of things do you think we can also look at there?
So you're absolutely correct in saying that this general category of technique that we use for diabetic retinopathy can also be used in a lot of other cases. The one that we've been looking at here most recently is in detecting skin cancer. So basically what we'll do is take natural light images of lesions on the skin or something like that, use trained data to produce a machine learning model that can then reason about these images and decide whether it's a cancerous lesion or if it's something that someone wouldn't necessarily need to worry about. There are a lot of other situations in which similar techniques can be approved for detection of things like breast cancer and so on.
So look, it seems that inevitably we're going to be using data in more and more complex but more simple ways that will enable us to deliver healthcare in a better way. So we're going to be working very closely with the likes of David and FHIR standards and with Chris in relation to cloud platforms. And we look forward to working with you in the future. Thank you so much for being at the ARCS 2018 conference.
I would just add to that, and I think one of the key parts is the ability to bring the consumer into the healthcare equation as a true equal to their care providers, and I think that's one of the key things that data and the collection of data and the ability to visualise data is going to bring.
And a very good point to David. I do believe in that. Our whole premise is about improving the healthcare system to put the patient at the heart of healthcare. Again, thank you very much. This is Shanny Dyer from the second plenary at the ARCS conference 2018.